So tomorrow at the World Parkinson's Congress, I'm going to talk about intimacy and sexuality and Parkinson's and how all of those two things come together. A lot of times doctors talk to their patients about sexual function or dysfunction and performance, and my talk is really going to be about how couples need to come close to each other and focus their sexual or sensual interactions really more around pleasure and connection. That's the most important thing that they're trying to achieve, and it doesn't really matter what their bodies are doing or not doing, and that their focus on what their bodies are doing or not doing tends to take them out of the situation or focusing on themselves instead of their partner. And so I'm going to try to help people broaden the way they think about sexuality as this buffet of different things that people can do, and that intercourse, for example, is one thing on the table, but that there's lots of other things that are on the table, and that each experience can look really different. And if we can let go of our expectations of ourselves and our partner, that then there's something that can get created that's new and interesting and different. Parkinson's patients tend to back away from sexuality because it can't look exactly like how they remember it used to look, or they used to be able to interact or perform during sexuality. And so part of what needs to happen is they need to see that for all couples, our sexuality evolves through life experience and stress and illness and for life circumstances. And so we need to evolve our concept of how we relate on a physical level with our partner. And so if they can broaden the way they think about sexuality and have a conversation about that and start doing things that are just really focused on pleasure and connection, then they can include themselves and participate in new ways, and they can evolve their concept of sexuality. The thing that I encourage couples to do is what I call the giver-receiver exercise, where one person's the giver and the other person's the receiver, and it is the receiver who asks for a particular kind of touch or a particular kind of experience. I want you to run your hands along my body really slowly, or I want you to rub my feet, or I want you to stroke my face, or I want you to just lay on top of me and hold me close. And so they might do this maybe for 5 minutes or 10 minutes, but the receiver asks for what they want, and the giver just gives it. Often our partner touches us the way they want to be touched rather than the way our partner wants to be touched. We give the kind of touch that we want sometimes rather than what our partner wants. And so the value of this exercise is that women and men get to really speak very specifically about how they want to be touched, and it teaches their partner a lot about how slowly or how much pressure their partner might want. And so then they switch, and the other person might ask for something completely different. But it's a way to just be sensual and maybe sexual with each other, but in a way that you're asking for what you want exactly, and your partner knows what that is. So that's one example. Another is I have on my website, or if you contact me, it's not on my website, sensual touch options. And it's a list of 25 or 30 ways of just being sensual with our partner that a lot of times people don't think of. And we have very narrow ideas of how to be physical with our partner, and so broadening that. I think sometimes women especially feel like they're meant to sort of walk around with desire, because men often walk around with desire, and so we compare ourselves and try to be similar. And the reality is that for a lot of women, we don't have spontaneous desire, we have responsive desire. That means we respond to touch, or we respond to something we're thinking about, or something that we're reading, or something that we watch. And so for a lot of women, desire kicks in once we start. So what I often say to people is, all you need really is a willingness to start, trusting that desire will kick in once a little bit of arousal has happened, that desire actually follows arousal. It doesn't start that's not where we start. And so that willingness to just start somewhere with something that you really want and ask for that, even if it seems small or simple, is a good place to start, trusting that desire will kick in later. The other thing that I often suggest for a lot of women, and sometimes men need this, is what I call bridging time, which is an opportunity. Maybe it's 10 minutes, maybe it's a half an hour, maybe it's an hour, where you separate from work. You separate from the roles that you might have, being a mom or your job, getting off the computer, walking away from the TV, and taking some time for yourself to just bridge into all of that doing into sort of more of a being sort of role. And there's a way in which, for a lot of women, by kind of relaxing, coming into their body, maybe taking a bath or doing some journaling or some meditating or just putting on something different or some lotion that smells good. Those are ways of transitioning into more of a more peaceful place, more of a relaxed place, and sort of transitioning into the space that they want to be in before they start being sensual or sexual with. I think it's really important that Parkinson's patients ask their doctors about any side effects that they're noticing from their medications, talking to their doctors and saying, this is what I'm noticing. Is there a different medication you can put me on that might have less sexual side effects? Often doctors won't bring it up with patients, and so they need to bring it up. The patient themselves needs to bring it up and ask questions, because sometimes some things, they're willing to talk about it, but you as a patient have to bring it up first.